intersection of gaming technology and rehabilitation has evolved into a promising avenue for enhancing physical and cognitive therapy. One significant development within this domain is the utilization of virtual reality technology as a tool for rehabilitation on a global scale. Our research explores the current state, emerging opportunities, and challenges, as well as the potential long-term impacts of VR in rehabilitation worldwide. Based on the research article, Effectiveness of Using Virtual Reality Using Wii Gaming Technology in Stroke Rehabilitation, we defined virtual reality gaming systems as novel and potentially useful technologies that allow users to interact in 3 dimensions with a computer-generated scenario engaging the mirror neuron system. We also defined Wii gaming technology to be a new style of VR by using a wireless controller that interacts with players through a motion detection system and avatar.
Delving into the current societal applications of VR rehabilitation, we found that VR-based assessments can provide objective and standardized measures of cognitive function and daily living skills, facilitating accurate tracking of progress over time. One such use is the Dynamic Difficulty Adaptation Technique, or DDA, which personalizes VR games and aims to calculate the difficulty level for players by increasing the effort needed without exceeding the abilities of the user. In 2011, researcher Kame Rao and peers developed a DDA rehab game in which players had to move virtual arms to intercept objects on the screen. The difficulty level was adjusted during a calibration stage by assessing the player's abilities to move their hands to numbered dots on a virtual tabletop using virtual arms. The use of this technique personalizes the rehabilitation game to its users, ensuring they can develop their motor skills at their own pace. Other societal applications include the integration of Wii gaming into sports rehab, which incorporates a significant part of sport, competition, and strategy, which cannot be as easily replicated through traditional rehabilitation activities. The increasing use of game technology is giving a rise to the term rehabilitation, which describes the use of the game technology in the rehabilitation process. Furthermore, Wii gaming allows you to manipulate and modify games/activities to make them accessible to the injured patients by changing the surface that the patient is standing on and or increasing the resistance. Clinics can also record quantitative data from Wii gaming rehabilitation through sensory motor control progression, increasing the clinician's control of the patient's rehab. In a case study on the effectiveness of virtual reality exercises in stroke rehabilitation, or better known as Everest, they created the first randomized clinical trial showing that VR-Wii is a feasible, safe, and potentially effective intervention to enhance motor function recovery in patients with a recent stroke and represents a proof of concept trial.
There are countless rehabilitation opportunities that VR currently offers, some of which include using Wii to help tackle multiple areas of rehab, such as weight transfer, balance, joint loading, muscular control, and proprioception, meaning it can be used to bridge patients from their athletic injury to getting back into the field. The cost of the Wii Sports package is also much less than traditional rehab therapy. The Wii Fit is under $400 compared to traditional therapy devices, such as the BAPS board and therapeutic modality units, which can all add up to $7,500. Numerous recent interviews and meta-analysis also validated that VR games had a potentially strong effect in improving the range of motion of the upper body in children with cerebral palsy when comparing pre-game data with post-game data.
Despite VR providing many opportunities in terms of rehabilitation, it also poses its own set of challenges. One of the main problems with using VR for rehabilitation are the high cost and challenging implementation. The initial investment in VR technology can be expensive, making it less accessible for some healthcare facilities or patients. For a startup company, the cost breakdown for implementing VR averages at $130,000 to $595,000. Many healthcare settings may not have the necessary infrastructure, such as compatible computers or dedicated rooms, to support VR-based rehabilitation programs. Updating the infrastructure to accommodate VR technology may require additional resources and logistical considerations. VR systems require technical expertise to set up and operate, leading to potential barriers in implementation and use, especially in clinical settings.
Another issue many found was the ethical considerations, as there may be ethical concerns regarding the use of VR in rehabilitation, such as issues related to patient privacy, informed consent, and potential psychological effects of immersive experiences. Integrating VR technology into existing rehabilitation setups may pose challenges in terms of compatibility, standardization, and regulatory compliance. An ongoing challenge with VR is the lack of research, such as educational studies or evidence to back up the effectiveness of using Wii gaming. Soor Khan's case study had a small sample of about 22 stroke patients, which could affect the validity of the overall study. Therefore, there has been limited research involving the incorporation of VR gaming systems in neurorehabilitation programs.
Moving forward, the coming years pose a new set of opportunities and challenges for VR rehabilitation. An opportunity that we can see in the next 5 years is accessible and remote rehabilitation services, in which VR-based rehabilitation can be delivered remotely, overcoming geographical barriers. Patients can participate in therapy sessions from the comfort of their homes, reducing the need for travel and allowing for more frequent and convenient therapy sessions. The use of targeted rehabilitation may also become more frequent, as therapists customize experiences based on patients' abilities, targeting specific cognitive deficits while simulating real-life scenarios to improve daily functioning.
We can also expect the use of adaptive exergames through AI and intelligent algorithms to increase in the near future. AI can be used to help develop rehabilitation programs to better entice the patients who use these games. This can be done by using patient data and merging users' preferred games with clinically approved movements that account for difficulty. Due to its personalized nature, these games are labeled adaptive exergames. A notable challenge that patients are beginning to face is cybersickness, or dizziness, as a result of the VR game's motion. This motion sickness has formed a barrier for some patients whose bodies are not responding as steadily to the LED screen and hyper-realistic environment. Similarly, long-term maintenance and support may also pose as an obstacle. VR hardware and software may require ongoing maintenance, updates, and technical support to ensure optimal performance and user experience. Healthcare facilities must allocate resources and staff training to sustain these rehabilitation programs in the long term. Despite promising findings, further research is needed to establish efficacy of VR interventions and validate the assessment of intervention protocols. Overcoming technological limitations such as hardware requirements and motion sickness is crucial to ensuring the effectiveness and accessibility of VR-based rehabilitation programs.
Traveling 10 years into the future, we might find that VR as we know it reshapes what is defined as traditional rehabilitation. VR-based rehabilitation can make physical therapy accessible to a broader range of patients. It can be delivered remotely, which is particularly beneficial for individuals who face barriers to accessing traditional rehabilitation services due to mobility limitations or distance. Advances in VR technology could facilitate remote access to cognitive rehabilitation services, overcoming geographical barriers and increasing accessibility for individuals living in rural areas. Also, integrating with artificial intelligence algorithms and big data analytics could provide personalized recommendations and predictive analytics, while AR, or augmented reality technologies, could enhance therapy sessions by overlaying virtual elements in the real world, providing real-time guidance and feedback. These integrations enhance the effectiveness of rehabilitation programs and facilitate the transfer of skills learned in VR to real-life situations, ultimately improving individuals' quality of life. VR can also increase the productivity and effectiveness of rehabilitation. In the case study, Adaptive Rehabilitation Bots in Serious Games, the Rehab Bot is introduced. The Rehab Bot includes a program that implements the treatment and acts as therapist for patients in rehab. The upcoming impact could be merging gaming and rehabilitation with rehab robots, which boosts how productive and effective treatment can be.
The integration of VR technology into rehabilitation practices holds immense promise for improving patient outcomes globally. Through the gamification of therapy with software such as Wii and personalized interventions using DDA, VR offers a novel approach to rehabilitation that is both immersive and effective. Despite this, our research also uncovered the pressing need for increased funding and research in this field. Addressing possible knowledge gaps through further research initiatives is essential to harnessing the full potential of VR in rehabilitation and maximizing its benefits for patients worldwide.